Welcome to the City Current Radio Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good in our community. We're going to kick it off talking about the Tennessee Poison Center. We're joined by Dr. Nena Bowman. She's a pharmacist and clinical toxicologist. How are you doing, Dr. Bowman?
I'm doing great. Thank you for having us. We're really excited to be here.
Absolutely. So let's start with some background statewide in terms of your efforts and your reach, but give us a little bit of a history lesson for the Tennessee Poison Center.
Yeah, sure. So our Poison Center is actually the only one in the state today, and we serve the entire state of Tennessee. So if you're calling from Tennessee, you will talk to us. And so we're actually housed at Vanderbilt University Medical Center. So we live here in Nashville, but we're happy to help all over the state. We've been around since 1988. So about 30 years, we just celebrated 30 years serving the state. And we just hit, I think, 2 million calls in that time. So, our job is really just helping the people of Tennessee know if a poisoning is going to be an issue or not. And, I think that it's not if a poisoning happens, it tends to be when it happens, because we all make mistakes. Adults make mistakes, they take the wrong medicine, or a lot of times we get calls where an adult's taken even a pet's medicine. So we're here to help with things like that. We are staffed by nurses, pharmacists, and physicians. It's totally free to call, and we're open 24/7. So you can call at 3 a.m. on Christmas and get a nurse, pharmacist, or physician that's ready to talk to you and give you advice if you need to go into the hospital or if it's safe to stay home.
So let's start there, because you do have the hotline. So go ahead and talk about the hotline number.
Sure.
So obviously we can share that, and we'll share that throughout, because you never can say it enough. But talk about the hotline, and like you mentioned, the fact that it is 24/7 access, and give us a little bit of just, you kind of mentioned too, maybe they take the accident of the pet meds and you actually take those, but give us an idea of just some of the, without naming names, of course, but some of the different calls you get.
Sure. So we actually run 2 hotlines right now. We currently have the Tennessee Poison Center hotline, which is our main hotline. We've run it for 30 years, and it is 1-800-222-1222. And that's a national hotline. So if you call that number, if you have a Tennessee area code on your phone, you'll get the Tennessee Center. But if you have a different state as an area code, you might get another state, but you'll get a Poison Center regardless. So what we will do is we typically take calls from both home callers and hospitals. So about 70% of our calls start from parents or nurses in schools, or grandparents or spouses is who makes up most of our calls. And a big part of our job is medication safety, right? So we really focus on risk assessment, and is it safe for you to stay home in a situation, right? Given your situation, whatever that may be. Most of our calls that start from home are with kids. So, during this COVID pandemic, we have lots of kids at home, schools virtual, parents are also working at home. So we actually have seen an increase in the number of kids getting into things while at home, right? So lots of little kids that won't go to daycare because parents are working at home now, that kind of thing. And little kids under 5, they kind of explore their environment with their mouths. So, putting Desitin in their mouth, or putting cleaners in their mouth, things like that are things that we help with. We also have had a really interesting time since TikTok has been really big and teens have been home, right? So there's a lot of TikTok challenges that have really gotten some national attention. So for instance, there was a Tide Pod challenge. We also had the Benadryl challenge, where kids were encouraging each other to take 16 tablets of Benadryl, and they would get very ill. A lot of them required hospitalization. So things like that. It's been a wild last 9 months for sure.
Yeah, and I mean, and that kind of hits home on the sense that you're obviously the resource there when people go into panic mode. At the same time, though, you almost have to be proactive and looking at social media and saying, okay, what's out there, what are these things that people, and especially kids, are looking at, teenagers, so that we can combat that with education, which leads me into the next phase, which is you do a lot around education. So talk about that world within what you do.
Yeah, sure. So the other part of what we do is poison prevention. So we send out almost 1 million pieces of poison prevention material to schools, to UT Extension every single year. This year we're focusing a lot on virtual presentations for daycare centers. And helping them to kind of educate their staff and their parents on things that are potentially dangerous in the home. So, a lot of people always ask us, isn't that the opposite of what you want, right? Because prevention, you would think, would drive down calls coming in. But the reality is, the more people that know about us, the more they'll be ready to call whenever they need to, because it's not always, you're not going to face a poisoning every single day in your life, right? But when there is one, which there will be, it's important to know who's there for you, who can help you.
What's a tip or a bit of advice, and especially for parents, as you mentioned, with the kids that now are getting into more because they're at home more, doing the virtual learning? What's a tip? I mean, obviously the medicine cabinet's up high, the child locks, some of those basic things, but just in general with poison control, what are some of the top tips you like to provide?
Yeah, we always say, keep things up and away, even if they're not in a locked cabinet. If you have little kids that are walking and opening cabinets, put those cleaners on another shelf, somewhere where they can't actually reach them. And, we've seen a lot with kids and hand sanitizers and even bleach, because we're disinfecting a lot more than we were. So we've been telling parents too, make sure you take the time to teach your kids how to use hand sanitizer and how to use some of these Lysol wipes and things like that, right? Because kids are being introduced to these things at a much younger age than they used to. And I think we assume, a kid knows how to use hand sanitizer. And the reality is they probably don't. Your 6-year-old going to kindergarten, you put a big blob of hand sanitizer in their hand. It's not first nature for them to think, okay, I just rub this on my hands. It's more likely they think, oh, that might be tasty, and they taste it. And that actually happens quite a bit. So, I think those pieces of education are more important now than they have been in the past.
Yeah, but it just shows you the things that you take for granted, you don't think about.
Right.
In the end, the curiosity kicks in and they go a different direction. And you think, okay, yeah, instead of rubbing it, they all of a sudden they want to, taste it or put it on their face or whatever, Home Alone. So it's like little things you just don't think about as a parent. And even going back to your point about the Benadryl and some of those, keeping those locked away, because you just never know what's going out there with social media, and just being vigilant.
Right. Very true.
Talk about surveillance and some of the stuff that I think you do that kind of flies under the radar, that's just kind of cool. So talk about some of those aspects.
Sure. So we do surveillance in a couple ways. So with our poison information hotline, what we do is we actually upload our data, and it uploads every 8 minutes to a national poison database. And we actually have people in our organization that go through that data and look for trends. So it's almost real time that we're able to discover, has there been a big food poisoning outbreak in a certain county in Tennessee? Are we all of a sudden getting 15, 20 calls with all the same symptoms? So we've been able to identify some big events like that. We've had a few big carbon monoxide exposures here in Nashville, where we got several calls from several different people, and realized it was a hotel having trouble. So it's things like that where we can do a little bit of surveillance that way. And then we also have our second hotline, which is we've been running since March, and it's for the Tennessee Department of Health. So we're running the coronavirus public health hotline through the Poison Center. So we have specialists ready to answer those calls as well. We've taken about 60,000 calls since the beginning of all of the COVID kind of stuff, and we give out general information. So, what phase is my county in doing vaccinations? What Where can I be tested for coronavirus? Those kinds of things. And so it is a separate number that's available on the Tennessee Department of Health website, but all of that does run through the Tennessee Poison Center.
And I know that number is at 877-857-2945. So 1-877-857-2945 for that specific hotline. Mm-hmm. For you personally, what's been, you can't say a favorite moment, a good moment, something that's put a smile on your face when you look at the ability to help individuals and families do the surveillance and connect the dots? What's been kind of a story that just illustrates the difference you can make for you personally?
Yeah, no, for sure. You know, so I went to pharmacy school and I always wanted to help people. That was always my intention becoming a pharmacist. And I think for me, spending some time at the Poison Center really opened my eyes to how we could help a fairly underserved, population of people. And I'll never forget one of my first calls. I had a parent calling. She was so upset. Her kid had eaten some hand soap and she was just panicking. It was the worst day of her life. She thought her child was going to die. And I was the one talking to her. So I knew in that moment, being able to tell her, your child's going to be okay. They're going to tolerate this. And just hearing her sigh of relief. And, she told me, we don't have health insurance. You probably just saved us thousands of dollars, things like that. And that was very impactful for me and finding satisfaction in what I do and that we could help people in that way. Right. So it's been kind of interesting for that. And the Tennessee Poison Centers in general, they do a lot of that. So we keep people out of the emergency department that don't have to be there, that don't need to be there.
Yeah. And I think, as a parent, that's your first kind of natural instinct. I mean, the protectionism kicks in, but it's like, oh my gosh, my child did this, ingested this, whatever. And so all of a sudden you go to that, like, are they going to die? And you go into that emergency, just protection, preservation mode. And I can easily see where you would be freaked out. And especially for those who don't have health insurance and don't know what to do. And I mean, that really is a lifesaver for them to find out it's going to be okay. Here are the steps that they can take or what to do and to put them on that track. So yeah, I mean, huge benefit for the community and for our state. Share how we can help. I mean, obviously for us as a community, knowing the hotline numbers, knowing you're there as a resource, continuing to push out education, how can we help?
Yeah, that's a great question. So what I would say is, just tell your friends about us, save our number in your phone. We are a nonprofit, so we're funded by a lot of state dollars, a lot of government grants and things like that. We do save the state. Last year, we saved the state an estimated $28 million in keeping state, funded health insurance, people with state-funded health insurance out of the ED. And so, just knowing who we are and being able to call us, those call numbers are what get us more dollars. So the more people we can serve and help, the more the state's willing to fund us. So that's always a great way to support us.
Yeah, and I like the idea, like you mentioned, putting it in your phone, in your contacts, because to your point, you never know when you're going to need you. Mm-hmm. And it could happen literally at any point in time, even if you're on vacation or wherever in the world. And so having that where you don't have to look it up, it's right there in your contact, that's actually in and of itself a really good tip. Talk about your website, talk about some of the others, re-mention the hotlines, and let's kind of wrap up with all the contact information so we know where to go.
Sure. So we do have a website. It's with Vanderbilt. So if you look up Vanderbilt University Medical Center and you type in Tennessee Poison Center, it'll lead you straight to our page. We do partner with United Way. So always giving to United Way is also a way to help us as well. So we have two hotlines, our Poison Hotline, which is the 1-800-222-1222. And then we also have the Coronavirus Public Information Hotline, which you shared the number earlier, the 1-877 number. So both numbers, we have people staffed ready to answer and help you with your situation. And our poison line is 24/7. Our coronavirus hotline is 10 to 8 during the week and 10 to 4 on the weekend. So we're happy to help you. We're here and ready.
Yeah, so VUMC.org is the website /Poison Center. And then, as we mentioned, 877-857-2945. And the other poison hotline, 1-800-222-1222. So, Dr. Nena Bowman, thank you for all you and your team do. Greatly appreciate it. Thank you for coming on the show.
Yeah, thank you so much for having us. It's been great.